contourization can be a rational alternative to regeneration. Ridge augmentation and other regenerative approaches have developed around one shared idea: restoring lost bone. So the regenerated bone integrates with the implant and supports a natural gingival contour. From the 1990s through the 2010s, extensive research built this into one of the most widely accepted strategies in implant dentistry. And for a long time, achieving this at an ideal level has been the goal many clinicians aspire to. However, as numerous systematic reviews have shown, regenerative procedures come with real challenges. They demand high technical skill, extend treatment time, and carry a meaningful risk of complications. In practice, patients face additional surgery, prolonged morbidity, higher costs, difficulty chewing, and long recovery. For elderly patients or those with systemic conditions, extensive regeneration may simply not be realistic. A regeneration-centered approach can place a considerable burden on both the clinician and the patient. Earlier, we proposed a strategic shift. The focus should move from alveolar bone regeneration and preservation toward implant-supporting bone stability. The key is not the alveolar bone itself, but the implant-supporting bone that remains stable even after biologic remodeling. If primary stability and osseointegration can be secured in a stable bone environment like basal bone, the next important question becomes this: how do we maintain long-term gingival stability and a natural contour from that point forward? Is there a way to achieve gingival stability and aesthetic contour comparable to regeneration with a simpler and minimally invasive approach? What if we could create and maintain the space needed to support soft tissue? In 1980, Maynard and Wilson emphasized that insufficient gingival thickness increases the risk of margin instability and apical migration. Forming a soft tissue environment robust enough to resist external stimuli and inflammation is essential for long-term gingival stability. Sabri and colleagues also reported that beyond bone volume alone, adequate mucosal thickness, supracrestal tissue height, keratinized mucosa width, and stable prosthetic contour are all important factors for long-term peri-implant health and mucosal stability. Suchelli, Mazzotti, and colleagues further reinforce this, showing that adequate buccal soft tissue thickness and a stable contour are key factors in sustaining long-term gingival stability and aesthetic outcomes. Building on these principles, a machined cuff is connected directly to the threaded portion seated in basal bone, bypassing the defect area. Instead of fully reconstructing the lost alveolar bone volume, the approach compensates by increasing soft tissue thickness. By thickening the gingiva, contour is restored and designed to be maintained over the long term, securing biologic stability. We define this approach as contourization. Jensen and colleagues reported that low substitution materials like DBBM maintain volume stability over time, contributing to the long-term stability of contour augmentation. From this perspective, BCP-based materials and collagen membranes that can maintain soft tissue space for at least 3 years without significant volume change are clinically meaningful choices for contourization. MegaGen's Bone Matrix 1 and Ossix Volumax are strong examples of this. More research is still required, but stable outcomes are generally seen when approximately 5 millimeters of horizontal soft tissue thickness is established from the fixture surface or machined cuff to the outer gingival surface. For example, when remaining alveolar bone is only 0 to 0.5 millimeters and existing gingival thickness is about 1 millimeter, approximately 4 millimeters of contourization may be sufficient to achieve stable biologic width formation. In conclusion, contourization is not a concept that stands against regeneration. Rather, it is another way of achieving what regeneration has always aimed for: natural gingival contour and long-term gingival stability in a more realistic and predictable manner. Even when extensive bone formation would burden the patient, securing sufficient soft tissue thickness and stable space maintenance can meaningfully improve the chances of sustaining long-term gingival stability. This approach reduces complications, applies more readily across clinical situations, and reflects each patient's individual conditions and needs. Contourization can be a rational alternative to regeneration. It aims to achieve gingival stability in a more realistic, biologically stable, and patient-centered way.